All right, you made it. You have it all, the life you want, except you're missing something. Welcome to The Guy Show, featuring the experts giving you the tips, tricks, and tutelage in wellness, lifestyle, and all things guy. And for the gals that love them, we're here to answer your questions on the things you want to know about. Welcome to The Guy Show. I'm super excited tonight. Super excited tonight. We have Dr. Robyn Benson on here. For 26 years, she's been a doctor of Oriental medicine. She has applied her knowledge of acupuncture, herbs, IV therapy, and regenerative therapies, along with leading edge energy medicine to help patients get out of pain and solve their most pressing health challenges. Dr. Robyn founded and built Santa Fe Soul Center for Optimal Health and pioneered self-care revolution, and is the creator of Amplified Regenerative Therapies, ART. Dr. Robyn is the author of the bestseller, Travel with Vitality, 7 Simple Solutions to Sleep Well, Staying Fit, and Avoiding Illness. She's a mother, adventurer, enthusiast, world traveler, and speaker. Robyn brings an innovative and game-changing approach to your health care. For today, Dr. Robyn, welcome to The Guy Show.
I am so excited to be on your show, Jerry. Woohoo! We've got a lot to talk about.
We got a lot to talk about here. So let's start off with a bang. What is erectile dysfunction and why is it more common today?
Oh my gosh, that's a great question. So erectile dysfunction happens in men, usually, 50s, 60s, 70s, but I'm gonna have to tell you this is it is happening in men younger now more than ever, in the 30s and 40s. And the reason is it has a lot to do with our wired and tired lifestyles.
Mm-hmm.
It has so much to do with the crappy food that we're putting in our bodies. Mm-hmm. And it's a very toxic world out there. So those are a lot of the reasons it's causing a lot of issues with our hormones, right? So a lot of men are, even in their 40s, have low levels of testosterone and free testosterone. And I'm certainly seeing that with my patients. Mm-hmm. So that's just a general overview, but stress is huge. That really does affect a man's ability to get an erection. And all the stress hormones that are flying around in the body and how that impacts you. So it's increasingly becoming a bigger issue. And I also want to talk about sperm, in terms of the fertility issues. Mm-hmm. I remember I just recently interviewed Dr. Tom O'Brien, and he was sharing a study, and I think it was between 1974 and 2012, that the sperm count in men across the board is 59% less. Mm. Yes, now that's serious. And so when he said when it hits 72%, there'll be extinction. Mm-hmm. So there are some big issues out there. So one of the most important solutions for especially these younger men is to, we're going to talk about, clean up your diet, right? Have more sex is a big message here today for a lot of men.
That's the show. You heard it right there.
I say it. Have more sex.
Ladies, listen to the show. You just heard the answer to fix your husband's health.
Exactly. I don't know if you see this too, Jerry, but when I look at my patients' charts, men and women, I'd say if I were, 26 years in practice, if I were to pull 10 charts out, I bet you 90% of them would say that they have low sex drive. Yep. Low libido is just, people are just living fast-paced lives and not having enough good bedroom cuddly time.
Mm-hmm. Exactly. And, you said 30s and 40s, and actually we're seeing it in the 20s now. The millennials are actually having a ton of erectile dysfunction and hormone imbalances from, like you said, environment and food, endocrine disruptors, chemicals in the environment, the EMFs and everything else. We're seeing it in a younger and younger population, that drop in testosterone, and then also the erectile dysfunction associated with it.
Right. Yeah, it's serious. And then we think about the correlation with ED and how many, the number one cause of death still is heart disease. So the correlation between having heart issues, high blood pressure, low nitric oxide levels, the beat goes on. So that is a big concern. And also the high levels of diabetics, right? And diabetes, we see so much of that. So once that is happening in your body, the chances of having ED go way up.
Mm-hmm. Yeah, and truthfully, it is as I tell patients too, is if you look down and you haven't seen that in a while, you might want to lose some weight.
you might want to lose some weight. That's one of many things. Yeah, get your fat levels down for sure. Start exercising, clean out your pantry and your refrigerators. It's amazing how poorly most people eat. The standard American diet is pretty sad. SAD is perfect word.
Yeah.
To the least.
Yeah. I call them grainitarians.
Yes. Yeah. Like it's crazy what's going on out there. But what I just read about the sperm count.
Yeah.
That is scary. You know, it's now around 59%. If it gets up to 72% extinction.
Yeah.
Like, whoa. This is something to consider, and it's amazing, you know, how it's not just a woman's issue, right? Very often it's the men's sperm. That's a big reason why we're not reproducing easily.
Yeah, and we're seeing it more and more in that process. And a few weeks ago, I had a guest on, and if I remember correctly, that and correct me if I'm wrong if you do these regularly, but a sperm sample, as long as 4% shows correct activity and morphology, it's considered fertile. 4%, I'm like 4%. Yeah. So if we've lost that 59%, if we get to 75, we're down to a 2% or less. That's considered infertile at that point.
It's scary. Yeah. It really is. And you know, you think about all these kids being born right now, right? And just when they check the umbilical cord, like over 200 to 400 toxins are found in newborns. Like, wowza.
Yeah, and what would we expect to happen with our
in the placenta,
our race?
Yeah, it's going to be an interesting next 2 decades. Let me tell you.
Yeah.
That's why we're speaking today. We're sharing some really good information on how you can certainly reverse ED, and if you want to have a healthy orgasmic long life, what you can do.
Oh, we're getting there. You're leading. You're like leading to it. You're jumping the gun.
You know what? Imagine that.
You're being a little bit premature on this one.
You know what? I have my moments, but for good reason, because it's an urgent issue out there, and men need to take this very seriously. And why I started the self-care revolution, right? Because self-care, it's all about choosing a self-care lifestyle every single day. And if people are on the Guy Show, I bet they already have this in mind, right? They know that and why they want to hear this conversation right now, because they want to know more about what they can do to have a healthy lifestyle.
Yeah. And, you know, as a doctor of oriental medicine, what is your approach in treating ED, erectile dysfunction, more naturally?
Okay. Well, I want to talk about the 3 treasures. That's something really important. Qi, blood, and Shen, right? So Qi is the life force in our bodies, right? That we want to fortify for the rest of our lives. So when people are Qi deficient, which we see a lot of, or they have Qi stagnation, we call it liver Qi stagnation. That means the blood flow is not moving as freely through the body. We don't have as much energy. So many people are terribly fatigued. So acupuncture is fantastic for ED, prostate health, helping with brain function. We need that too, right? And cardiovascular function. So that's really huge. Herbs are amazing. We use lots of different ashwagandha. I have a really great supplement, Arouse, for him. So we want to, arginine is something that's very, very good. We are huge on diet. I mean, getting rid of all inflammatory foods. So that's literally alcohol. We were talking about alcohol before we went on the show here. Bad oils. There's so many bad oils out there. So I'm going to just tell you what the good oils are.
What are the good oils? Yeah,
avocado oil is fantastic. Coconut oil. Olive oil is very good. So stay away from the bad fats, like the hydrogenated oils and canola oil, sunflower oil. A lot of those oils are bad. Too much of the omega-6. And so diet is essential. And if you're going to eat meat, and I'm more of a paleo girl than anything else, so grass-fed meats are good sources of protein, and also fish. You know, staying away from the fish that are high in mercury, like swordfish, and staying away from a lot of like I always say, shop just the perimeter of the store and stay away from all the packaged foods that's causing inflammation in your body.
Yep.
And choose a more plant-based diet. That's the answer, right? More plant-based. And, not having a huge steak at every meal. It's amazing how men think that's the only way they can build muscle, right? Mm-hmm. So those are probably some of the most important, food suggestions. Onions and garlic are really good. Studying, the ancient Roman times, arugula is a natural aphrodisiac. So increase your arugula. Bananas are rich in potassium. Those are also really good. So a lot more green leafy vegetables and a low grain diet too. I'm not a big fan of a lot of the grains that are out there, and certainly staying away from wheat, dairy, and sugar. If you just do that, you are going to be in much better shape. And smoking, of course, is not good. If people have AD and you smoke, you gotta let go of those cigarettes for more reasons than one. Mm-hmm. So those are some of probably the most important herbal choices. You know what? I want to mention NEO40. I don't know if you know Dr. Nathan Bryan, but nitric oxide is really important for having erections, as you know. And we have a lot of people are depleted. In fact, when we do this little strip test, and you can just put it on your tongue. I don't know if I should share mine right now. I'm gonna lick it, and whatever color, the pinker it is. Oh my gosh, I'm scoring pretty high because I had a lot of arugula today and beets. And this are really, really good too. But you want it to see that pink color, Jerry. I'm pretty proud of my nitric oxide levels. This is for women just as much as men. Okay. And healthy heart and good blood circulation. So this is what it looks like. But you can actually get this on Amazon, of course. But
NEO40. Okay.
NEO40 is fantastic. And it tastes really good. And the research behind this product is astounding. Mm-hmm. So we've been offering this to our clientele for the last several years. And it's just something that you want to keep those levels really high and to keep your blood vessels very healthy. So all my diabetics, all of my patients with heart disease, you want a healthy brain, you want a healthy body. Nitric oxide is very important.
Now, the test that you just did.
Yeah.
Is that part of that NEO40?
Yeah, you know what? You can buy this too. Okay. I would just get these indicator strips so you can find out. And you want to look like this. I wish you were going to be tested right now. I wonder how would you show up on this?
I would be so pink.
Would you be so pink? Would you be pinker than me? I don't know.
I had a bunch of beets for lunch today, so I would be fairly pink. Now, arugula I don't like. I don't like the taste of arugula. It's too bitter for me. I'm a bitter taster. But the beets, no problem at all.
Okay, so can I look at your tongue, Jerry?
You don't want to see my tongue.
I do. Can you go live? You got that kind of geographic tongue. Yeah. Yep. Interesting. You're born that way. No wonder you're so unusually wonderful. Special. But when I look at the rear of the tongue, for all of you, I'd like you to look at your tongue tonight. And if you have a lot of coating, that shows that you have yeast overgrowth. That's a pathogenic influence. We call it external pernicious influence that totally affects how chi is moving through your body, how your blood is moving, and it affects your essence. I mean, it affects your sperm. The health of your sperm matters, let me tell you. So yeah, watch the sugar. That's a very important message. So I mentioned the three treasures. One was tea, the second one was blood, and the other one is essence. So we are born, this was kind of our genetic blueprint. This is that kidney essence. That's part of what sperm is, and the ejaculate. And women have that too. So it's something that as we age, we have less and less of it. So everything that we're talking about tonight is really important for continuing to build healthy essence in your body. And, as you know, I'm a regenerative medicine. I would say that's an expert. That's what I'm so passionate about. My 26th year, the last decade of my practice. What that really means, regenerative medicine it's all about how are we continuously building healthy tissue? How are we regenerating the best of the good? Our head hair, our good, facial glow, our skin, our organ systems, rather than the degeneration process. So I'm always advocating a regenerative lifestyle. And that word regenerate means to have a second chance. It's a rebirth. It's new beginnings, new opportunities. So that's a big message to all of you listening to sign up for a regenerative lifestyle. So if you're feeling like, oh my God, I have a lot of these symptoms that Robyn's talking about, and I'm holding an extra 20 or 30 pounds on my body, I'm still smoking, I have ED, then these are the simple solutions that we're talking about. And I will talk about the drugs that are out there. I'm not necessarily against them, but I'd love for all of you to get your blood work done, work with a functional medicine doctor, a doctor like Jerry, or a doctor born into medicine like myself, and have a whole profile done in your hormones. And men have estrogen too, right? Could survive without it. And there are a lot of men with men boobs. So we have to look at that estrogen dominance issue.
Which we see a ton of with the testing we do, is we see a ton, particularly in my clinic, we see a majority of men are actually estrogen dominant. Testosterone may be good or slightly lower, still within range, but estrogen is super high in the men.
And so what do you do for your men with estrogen dominance?
We use a couple, depending on where we know what the cause of it is. If it's environmental, is of course limiting the environmental influence there. But so that's one thing we do. But also giving blockers of estrogen metabolism in the body itself. So chrysin, some other ones to prevent that conversion from testosterone to estrogen, and also some clearing things. So like some DIM, diindolylmethane, or diindolylmethane, along with some other ones that help the liver help clear out that estrogen from the system too. And for the ones that do it, we see, because they usually can't lose weight. If they have high estrogen, they're not losing weight no matter what they do. And so when we do that and then have them on a sensible eating plan and then some exercises, they start dropping body fat like crazy.
Exactly. No, some great suggestions there, because it is a serious problem, and it just sets you up for more dis-ease, right? Yeah, it's something to really consider. Glutathione. I'm a big fan of liposomal glutathione. Really, really good for liver and every single cell in your body. It's one of the most important antioxidants known to man. So,
are you using an IV with that, or an IV push with that, or are you doing actual oral?
You know what? The one I like, it's so good that I can just like reach a foot and find everything I want. This is the one I love. It's Tri-40 watermelon flavored, is really good. But I have a big IV practice too. So very often we'll do like a vitamin C drip followed by a glutathione push. And that's a great way to boost your levels. And I don't think I've hardly ever seen a body with normal levels of glutathione without supplementing to some degree, especially when you have a health issue, acute or chronic issue going on in your body. But also for everyone listening, we want people to buy into this preventative lifestyle, right? Again, that regenerative way of producing healthy cells and tissue and reversing. It's possible to reverse ED and prostate issues for sure.
Yeah, most definitely there. We'll lead into something that we're really going to get down and dirty about here, the P shot.
Yes.
So we hear, it sounds promising. What are some of the results? And some people don't even know what this is. So you're going to do a demonstration, not on a real person, because we get banned from Facebook if we did that.
We would.
But the P shot, what are the results what is it? What are the results you're having with it? Because there's a recent article that came out in Men's Magazine with Ben Greenfield about this.
Yes. And, since I offer the P shot here at my office in Santa Fe, New Mexico, this is the article that came out in a recent, I believe it was this one. I don't know if you have it too, but it's this magazine. So anyway, Ben Greenfield, I know Ben. He is a character. I think I love that photo.
He lives right by here, so.
Oh, he does? Yeah. Okay. And then this one totally cracks me up. How he's doing LED lights to help get his man groove going even better. And it sounds like it's all been very effective. Okay, so the P shot is known as the Priapus shot. And my friend, Dr. Charles Ronels, is the man behind the P shot. So about 7 years ago, he came up with this idea. He also came up with the O shot for the women. I offer both of those. And what the P shot is, it's a form of platelet-rich plasma. So this is a procedure where we take blood from your arm and then we spin it in an FDA approved centrifuge, which takes 11 to 15 minutes. And then we get your platelet rich plasma, which is that part of your blood that's rich in growth factors. So for men, I need double the amount of PRP than I do for women. I wonder why. So anyway, so then the next part, how's this?
That looks a bit old and droopy.
I know, but we're going to resurrect this droopy looking thing. Okay, with this pea shot. It's a true story. About half an hour before the show, I said, Harris, I called my son. I live like 4 miles away. You've got to bring a banana because I don't have one, because bananas are, like I mentioned earlier, rich in potassium. Not that you should eat a whole one every single day, but potassium is really important and really good for prostate, penile health. So anyway, this is what I do. And I was very kind to get a very small needle to show you. So let's imagine I have the PRP in here. So what I do is I put numbing cream on first for about 15 or 20 minutes before we do the procedure. And then I also can do a block with Procaine right up here. And that can help the extra numbing, but I'm not sure that really is necessary. Quite frankly, compared to doing the vampire facelift or a hair lift, I love doing these and O-shots because there's minimal, if any, discomfort. It's almost the stress of it more than it is uncomfortable. One thing I want to mention, when Ben Greenfield had his procedure done, he had PRP and his own stem cells, which is a pretty awesome combination. If you can get that done, that would be good. And there's other doctors. I know that Charles Ornelas, that's where I did my training. He trains doctors all over the world. It's pretty exciting that this is possible. But that you can use like mesenchymal stem cells from a cord from amniotic fluid. So that's also a possibility. Okay. So anyway, so I've done my numbing, and then I come in and do the fun part of the procedure. So the corpus cavernosa, on both sides here, that's when you actually have an erection. That's where all the blood flow goes through. So we
lift up that banana a little bit.
Oh, let me make sure. Can you see it, Jerry?
Now we can see the banana.
Ooh. All right, we want to see this. All right, so I inject. I just go in. I don't have to go very deep at all, and I put 2.5 cc's right there, about the 10 o'clock position on either side. So that's about 5 cc's. Then I come down here.
Lift it up. And then I do about 1.5 cc's of your own PRP on either side. And then we come right here, and that's called what's the rim called? The frenulum?
The rim is called see,
you can't even answer.
Oh my God, it's called
the tip?
I cannot believe, how could I
Called the tip?
It's the rim. It's called oh my goodness. Charles would be so disappointed in me if I could. Okay, anyway, this is the part that men can freak out more than any other area. But I go right into the rim, like sub-Q, and just go, and then put in 1 cc right there. So that's a total of 10 cc's. Okay, so did you get that? So 2.5, and then here, and then right there in the rim. Okay. So then what's really important part of having a P shot is called the penis pump. And so my clinical assistant is in charge of this. And so right after, because the platelets are very active, biologically active, and the way that this really works to help you understand why is that these platelets are rich in, as I mentioned, rich in growth factors. So when you inject them into the area, it's the best way to describe what's happening. It's like when you scrape your knee. Remember when you're a little boy, or maybe it happens to you now because you ski every weekend. We can have our little bumps and bruises and all that. But when that yellow gooey stuff, that's like your platelets in action, right? That's all the yumminess of life is going to heal that tissue. So it's amazing when you get a really bad scrape and then it looks almost better than ever, right? Sometimes afterwards, because of all those growth factors, especially when we do it on the face, it's rich in elastin and collagen and all kinds of amino acids and goodness of life go in there. So it increases blood flow and it increases tissue very often, especially, we know for a fact when we do the O shot, which we do proximal to the G spot, it actually helps women with incontinence because it's increasing blood flow, increasing tissue, growth of tissue in that area. So for a man as well as a woman, there's more sensation. If men use the penis pump well, there's very often a shift in the girth and sometimes in the length as well. But just as we age, it's like an organ that loses its life force, and we want to. So it's good to. Is it good to do in a 40-year-old preventatively? Absolutely, but especially men in their 60s, 70s, it's a great thing just to bring more energy.
Yeah, restore the roar. Restore
the roar, to have better kickstands. Always remember Dave asked me about kickstands and a podcast with him. You want those morning kickstands. You want more of those. So that's essentially what a P-shot is. And the penis pump is recommended like 10 minutes twice a day. So yes, you're actually using this pump 10 minutes a day. So it's a great time to do your meditation, have it be a quiet time to tune into your body, which is another really great way to have a good, healthy life. Yes.
Focus and visualize growth.
Exactly. Yes. You're funny.
Hey, you're giving me all the lines. I can feed him there.
I'm giving you a lot of lines. Absolutely. Absolutely. So I want to mention too, in terms of the efficacy of this, I mean, most men have been really happy with the results. And again, it's really good to work with an integrative doctor, functional medicine doctor, someone who's going to really look at the blueprint of what's going on in your body. Again, to know your free and total testosterone levels, look at the PSA, look at all of what's going on in your body, get a sense of the health of your heart and your liver and your kidney function. And can men get a P-shot if they're taking Viagra, Cialis, or any of those? It's yes, absolutely. We don't necessarily tell our patients to get off it, but very often they don't need to use as much. And to expect how long will a P-shot last? It's so individual. It depends on all the factors we've talked about. Do you have heart disease? Do you have diabetes? Do you have 20 or 30 pounds of weight to lose? But the healthier the guy, the healthier the longevity of the P-shot. And men with Peyronie's, which is like a curvature of the spine, which really looks more like this, and it's kind of unknown, like why does it happen? But it's a curvature of the penis that usually can get progressively worse, and there's actually scar tissue, and that's where I actually inject right into the scar tissue. So PRP in general is fantastic for scars. It's amazing for scars, in fact. Really good to regenerate healthy tissues in knees and backs and hips. So we pretty much use PRP all over the body.
And the healthier person, the more healthier their PRP will be for them too.
Exactly. Yes, definitely. Just simple things like hydration really matters. Like most people are dehydrated and have no idea how that's impacting their health, and they're not getting enough minerals and low on vitamin D. I mean, you see this all the time. Zinc and magnesium. Oh my gosh, we do tests all the time. Yeah. I'd say 90% of every person who walks into my center is deficient in zinc, and zinc is important for erectile function.
And for sperm function and production too.
Absolutely. Absolutely. So have more oysters, have more lamb. Those are some good choices.
Good thing there. Now we're talking before the show started here about guys. I mean, women can be multi-orgasmic, but guys can be all multi-orgasmic too.
You know what? I want to say that this is important if you've never heard about being multi-orgasmic, because it's kind of been hidden. I mean, it's only coming out now about women having a G-spot, men have a G-spot as well. But the idea of being multi-orgasmic can be life-changing for a man, not only for a man, but for your partner too. So it means being able to experience the full range of male orgasmic potential, including ejaculatory orgasm. To be a multi-orgasmic lover means that you can make love longer and more intense, bringing your partner to full satisfaction, to full. Okay. So what is really important to know here is that it's important to know about the anatomy of your body. And breath is so important. So it's the idea that you can have sex for longer, that in terms of your longevity, you can look for like a longer life because you're multi-orgasmic. That means that you can hold the ejaculation for longer periods of time and have orgasms without the ejaculate. And they can go for hours of good sex without ejaculating. So the muscle that's important to know is called the the PC muscle. I just called it, thank you, dear. The PC muscle. Very important to get to know what this is. So the best way for any of you to understand this is when you think about, men know how important Kegels are, right? And you should practice when you feel like you have to go to the bathroom to actually contract your muscles, and that is your PC muscle. Men should really touch their perineum. That's the skin between the scrotum and the anus, and that's a pleasure center. So get to know your pleasure center. So anyway, it's really working with the energetics of the PC to actually move the energy up. Like when you feel like you're going to ejaculate, to hold it and move the energy up your body and have it multiple orgasms. And then when you finally do ejaculate, it's just much more potent. For men to be potent in general is listening to everything that we've shared so far, Jerry, in this very informative conversation. So it's something to think about in terms of increasing consciousness in men too, and in women for that matter. Women are multi-orgasmic, can be multi-orgasmic, but just the high and the oxytocin, the flow of hormones, and actually restoring healthy testosterone levels in your body by being multi-orgasmic is another important health benefit. So I'm glad I mentioned, it just came to me, oxytocin, but this is really important for men to realize that this is like the hugging hormone, and having more oxytocin in your body on a regular basis is very good for youthing and having more of that glow. You know, your coworkers are going to say, what's going on, Jerry? You're looking like extra glowy today. What's new about you? I'm glistening. You're not only are you glowing, but you're glistening. But this, again, understanding this PC muscle is important, and knowing the power of the prostate, right, where this ejaculate is made. Stimulating that, it's actually interesting. I'm reading that there's like kind of places around the country where you can go and have someone massage your prostate. But I think it's kind of good for men, as much as it is important for women to know where her G-spot is, for a man to feel where that is in their body. Get acquainted with your G-spot and what it feels like. It's about 2 inches up into the anus, and it's like a walnut shaped. It's walnut shaped and spongy, and it's got a lot of nerve endings, and it's a pleasure center. So I just think this is important for men. Why is there so much freaking prostate cancer right now? Because that's not getting the attention it needs. Yeah, not enough show. And I'm thinking all the guys want to know all this, the ancient Chinese secrets, right? The ancient Taoist secrets about how important it is. But for the men who are not multi-orgasmic, I would just Google it and get Montauk Chia's book and learn how to do it, and it will revolutionize your sex life and your partners. And also just want to say to get to know the female G-spot too, and that's such a pleasure center, and that know that women have the ability to produce ejaculate as well. Yes. So I also want to mention, oh gosh, there's a course online. Oh dear. I'm actually going to find it because Susan and Tim Bratton, you can just Google their names, but they teach a class that will help you understand how to become multi-orgasmic, and they're super amazing educators online. And I think it's called Personal Media.
We'll get it and we'll get it posted in the comments.
Okay, darling, that would be great because I want people to know that this can be possible.
Yeah, it's important. It's important for not only for health, but for the relationship too. Because so many people, so many couples, their biggest complaints is that lack of drive, that lack of sex, the lack of intimacy that occurs there.
Yeah, it's an epidemic of that going on. You know, I got to tell you one more pearl.
Yeah.
The use of ozone is amazing. So since I've used ozone for the last 14 years, I do prolozone, which I inject joints with literally the gas ozone, also with procaine and other things, but it helps to restore ligaments and tendons and joints, and helps to strengthen and tighten immediately. But with the P shot, when I after doing the PRP, following it with the ozone, it's pretty amazing. It's a very biological active molecule, and it also helps with the girth and the length and more sensation. So I'm just experimenting a little bit, and I'm then thrilled to see the response that men are getting. Good.
Now, how often are men coming back for that P shot? I mean, again, you said it was variable.
Yes, it's variable. So the older men will probably, if they're really happy, I'd say like 3 to 6 months later will come back. Definitely with Peyronie's, that will take like at least 2. Same thing with my women with lichen sclerosis, which is an autoimmune disease. And men, it also happens in men. But to know that your own PRP can help rejuvenate, like sexually rejuvenate and rejuvenate healthy skin. Because it's like an infection, a literally an infection that can eat away at the hood and the vaginal tissue. As same thing with a man. Yeah.
How can people? What's the best way to detox?
The best way to detox is I'm going to say clean up your environment, right? So getting away from all the bad lotions and potions and detergents, right, that were around all the time. One of the most important things to detox is to get away from electromagnetic pollution. Like, I think
except for right now, watching the show or listening to it. Don't get away from the show yet.
Oh, heck no. I have what's called a Gauss meter. I have a lot of great props. I prepared for all of you tonight. So this is a Gauss meter that measures electromagnetic pollution. So a laptop, that's the worst name ever, right? Like laptops in your lap, you notice that they heat up. So when I go to college campuses, I'm amazed when you go into like pubs and you go into libraries and all that, the people are just sitting there, right, with their laptops in their lap, hours on end. And it's terrible because it shuts down blood supply to that area. And over time, the accumulation is pretty bad. But I just want you to hear what is coming out of your laptop. Do you hear that hissing noise? It's a static field of electromagnetic pollution, and it affects your sleep. It affects blood circulation in your body. It totally gives you bad moods, right? Like get away from that blue light. So detox, pretty much what I mentioned, like having a plant-based diet is really important. Glutathione, increasing your levels of nitric oxide and glutathione and NAD. Vitamin B1, vitamin D3. You just want to keep your body getting rid of the bad guys and bringing in the good. Again, that regeneration, you want that activated on a basis. But detox is important. When we think about heavy metals, staying away from tuna fish and those high mercury foods. And also that could be a huge issue in ED as well. So if you have high levels of mercury and lead and cadmium, it can be affecting your brain health as well.
Very much so. It's so avoiding those environmental things and that are endocrine disruptors that are creating part of the scenario too, but also causing the weight gain, causing the fat mass and everything there too, just like you were saying. So cleaning
Exactly.
up the diet, getting healthy, getting active, you know, taking your vitamins, as Hulk Hogan used to say, pumping some iron, you know, getting healthy. There are
Oh,
some.
pumping iron, absolutely. High intensity interval training. I mean, just 5 minutes is really
Mhm.
important. You know, when we were talking about that PC muscle, like people who do kettlebells, you know, when you contract that perineal area, that is such a great habit to get in too. You
Mhm.
don't have to be holding a kettlebell, but that core fitness really is helpful.
That thrust.
So when you're at your next stoplight, just do your Kegels.
Mm-hmm.
Kegels.
Actually, we tell people to do this all the time. That definitely strengthens the penile muscle itself.
It's really helpful.
The CG muscle there, it really strengthens it for stronger erection and for better angle of erection too. Because as we age, that angle does decrease.
Yeah, because you don't want to get a penile implant. I haven't found that men that I know that have done that have been happy in the end. I mean, there's so much you can do.
Mm-hmm.
Even if you don't get a P shot and just get a pump. I mean, that's
Mm-hmm.
something else you can do. But get your hormones balanced. Get your testosterone levels up by eating foods that really foster testosterone in your body.
Mm-hmm.
And I
Now,
think if you need hormone replacement, I'm a fan of bioidentical testosterone, but I think it's also important to get a blood test or do a 24-hour urine test to really find out what your levels are and not to do too much testosterone is not
and
a
how
good.
you're metabolizing it. I mean, that's so key in that process to really know how a person's metabolizing those hormones so we can prevent estrogen dominance again in a person or other issues of conversion of testosterone to the wrong testosterone breakdowns.
Mm-hmm.
Yeah. Robyn, any last tips, tricks, or tutelage you want to give the guys here and the gals? Because I mean, it's truly for guys and the gals that love them, and this is an amazing episode. We're going to be seeing more and more Ben's article on the P shot and everything, so that's why I was glad to have you on because you're going to see more. You're going to get busier and busier for it because guys are going to be wanting to have it done, but it's important that they know who to go see for that procedure.
Right. Well, if people want to find out more about what I've shared today, I have a wonderful gift. It's simply go to Robyn Benson. It's ROBYN Benson.com/gift. And you can find out about what I consider the most important pathways to live a regenerative lifestyle. And I list out these procedures, the P shot, the O shot, the prolozone, the PRP, so you can have a better understanding of how invaluable they can be. And finally, I just want to say to all of you, you know, life is short and live it to your absolute best. So, and there's no way to do that without taking really good care of yourself, loving yourself to pieces, to show up for life and people and family and your animals and all that jazz.
All
So,
that stuff.
and practice self-care like never before. I mean, it's such an urgent message because we are all in this together, right?
Mm-hmm.
And it is pretty alarming, really, these statistics and everything I'm sharing in terms of if you're feeling depressed and have anxiety, you're not sleeping well, just re-listen to this conversation and share this message with your family, friends, and colleagues that would value from this, because sexual health
Mm-hmm.
is so important. It's such a root of how everything else plays out in your life. It truly
Mm-hmm.
does. And just feeling empowered and being connected to your big why. You want to restore that. You want to become multi-orgasmic. And you could do that like literally starting today.
Mm-hmm.
Just yes, it's very simple to learn, and it's really again a great way to increase your consciousness and your awareness and your connection to all that is.
Mm-hmm. Mm-hmm. Well, great advice from you, Robyn. Again, thank you for being on the show. Go to her website, robynbenson.com. Go to the robynbenson.com/gift to get the gift there. It's on the comments there, pinned to the top already. Check her website out. If they can't get to see you for the P shot, is there a association or a plane to go to find out who in their area they may need to
Exactly.
go to? Because ideally, they should go see you. But
Absolutely, because we have like a whole room devoted to health technologies, all of these ways to boost everything that we're talking about. We make it fun, absolutely. Um, Yes, you can actually just Google P-shot and you can go to Dr. Rennell's directory of doctors that have been trained in his procedure. So that's definitely the way to go. And I would just say find somebody that has an integrative approach that will educate you on the diet, educate you on detoxification, and how literally to turn back the clock. Because again, healthy sexual function, you can have it into your hundreds. How long are you gonna live, Jerry?
I'm going to live 250 years.
I'm 140.
Okay.
I've had a couple of those shots too, so I've got that going on. I have to say, it's really amazing how much that can help. So yeah, and people can call me if they just call my office at Santa Fe Soul Center for Optimal Health. My staff is well versed on this. If we can answer any of your questions, we're happy to do that.
Yeah. Well, again, Robyn, thank you for being on the show and all your tips, tricks, and tutelage for my audience. And everybody, check her out. Go to her website. Check out her clinic. Get yourself healthy so, one, you can maintain erection, and two, get a P-shot so you can have a stronger erection and learn to be multi-orgasmic there.
Absolutely. Bingo. That's the trio. I like that.
There you go. There you go. Well, thanks again, Robyn. We'll see you all later.
Thank you, Jerry. It was a pleasure to be with you and to this wonderful audience tonight.
Thank you. We'll see you later.
Bye-bye.